Causes and how to recognize diabetes. Diabetes is a group of medical diseases, caused by disorders of insulin metabolism in the body, leading to high blood sugar levels. Determining the cause of diabetes is an essential step in choosing the most effective treatment and treatment. Diabetes, medically known as diabetes mellitus, is a very common chronic metabolic disorder. With diabetes, your body loses its ability to use or produce the hormone insulin properly. Having diabetes means you have too high blood sugar for many reasons. This condition can cause serious problems for the body, including the eyes, kidneys, nerves, and heart. Determining the cause of diabetes is an essential step in choosing the most effective treatment and treatment. To know what causes diabetes, you must first understand how glucose is metabolized in the body. Glucose exchange. Glucose is an essential substance for your body. It serves as an energy source for the cells of muscles and tissues, especially the brain. Glucose is found in the food you eat and is stored in the liver, forming glycogen. In case your anorexia leads to too low blood glucose levels, your liver will break down glycogen molecules into glucose and rebalance blood sugar levels. The blood absorbs glucose and delivers it to the cells in the body. However, these cells cannot use this fuel directly, but must have the help of the hormone insulin, produced by the pancreas. The presence of insulin allows glucose to be absorbed into the cells, lowering blood glucose levels. Then, when your blood sugar has dropped, the pancreas will also reduce insulin production. Any abnormality in this metabolism can prevent glucose from entering cells and providing energy. As a result, sugar remains in the blood. This imbalance builds up over time and leads to significantly high blood sugar levels, known as hyperglycemia. Classification of diabetes. Diabetes is classified into three main types: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes. Type 1 diabetes is an autoimmune disorder in which the body's immune system attacks the pancreas rather than external factors. This causes a lack of insulin and an increase in blood sugar. If you have type 1 diabetes, symptoms will appear early. Currently, the cause of type 1 diabetes has not been determined. However, doctors believe that the cause of type 1 diabetes may be genetic or environmental. You have a higher risk of type 1 diabetes if you fall into the following categories: mother or sibling with type 1 diabetes, the presence of diabetes antibodies in the body, vitamin D deficiency, early use of cow's milk or cow's milk powder, and use of cereals before 4 months of age. Type 2 diabetes. This is non-insulin dependent diabetes, the most common type of diabetes today. The disease usually occurs in adults. However, due to the increasing prevalence of obesity, the prevalence of obesity in adolescents is increasing. When you have type 2 diabetes, your cells are resistant to insulin. The pancreas cannot produce enough insulin to supply the body. Instead of moving to produce energy for the body, sugar builds up in the blood. Gestational diabetes. Gestational diabetes is a type of diabetes that occurs during a woman's pregnancy. This disease can cause problems for both mother and baby. However, gestational diabetes usually goes away after the mother goes into labor. Symptoms of diabetes are. Symptoms of diabetes include feeling extremely thirsty, also known as polydipsia, urinating a lot, sometimes as often as every hour, also known as polyuria, unexplained weight loss, feeling exhausted and tired. You may or may not have other diabetes symptoms, such as nausea or vomiting, blurred vision, frequent vaginal infections in women, yeast or candida infections, dry mouth, slow healing of sores or cuts, itchy skin, especially in the groin or vaginal area. You should go to the hospital for a checkup or see a doctor if you notice any of the symptoms of diabetes mentioned above. In addition, you need to call 911 right away if you feeling nauseous and weak in arms and legs, feeling thirsty or urinating often with abdominal pain. Breathe more quickly. Diabetes is a disease that can affect all subjects, especially now this disease is also at risk of young people.